Hi, I'm AJ Fisher, creator of the HYPOXiX method. Did you know that controlled breathing and also intermittent hypoxic training can be a potential non-pharmacological therapeutic for asthma? Now, while I'm not a doctor and we are certainly not prescribing medical advice, there are many studies that do support improvements in asthma symptoms when using voluntary breath control and also intermittent hypoxic training in a strategic programmed protocol, including hypoxic training, hypoxic exposure, long exhalations, long inhalations, controlled breathing, and it uses a variety of mechanisms to improve those symptoms. We need to look at the psychophysiological, the biochemical, and the biomechanical when programming a successful strategy. Toward the end of this video, I'm going to take you through a series that has been shown to be successful to improve asthma symptoms. Before scrolling to the end of the video, please like, subscribe, share this video as it helps to support our channel. Also, please visit hypoxix.fitness. There you can join the free community, become a hypoxonaut, and learn about HYPOXiX training and breath training. Additionally, please visit hypoxix.studio to join me for on-demand and live classes where I will give you feedback if you come on into class. FEV, or forced expiratory volume, is the volume of air that you can exhale at a certain rate. So it's ultimately measuring the strength of your lungs to forcefully exhale a volume of air. This is typically measured by a peak flow meter. Typically, asthma patients have a lower than normal score when taking their FEV with a peak flow meter. There are many studies that support the use of a technique called the forced expiratory technique, in which a forced exhalation is used to improve that FEV score. Some asthma patients have even been shown to no longer be classified as asthmatic after going through a protocol where they're using this forced expiratory technique. Additionally, simply focusing on breath control can help an asthma patient because hyperventilation tends to be both a catalyst and a consequence of an asthma attack. If we can learn to control our breathing and prevent hyperventilation so that we're not triggering an asthma attack and we're also not suffering more severe consequences as a result of an asthma attack, we are going to be better off. There are many studies that support breathing exercises simply help to reduce the frequency of hyperventilation. For those of you who do not know what that is, it is simply breathing faster than the normal rate. There are many reasons why hyperventilation is not good for the body. Certainly, it induces panic, and if you're already in a state of panic, it's only going to make that panic more severe. Additionally, it causes physiological changes in the body that can aggravate asthma symptoms even more. There's strong evidence to show that increased rates of breathing, hyperventilation, causes an imbalance of carbon dioxide and oxygen in the body. This not only triggers the body into a more severe state of panic if you already were in a state of panic having an asthma attack, but additionally, it dysregulates the carbon dioxide levels in your lungs. This in itself can be a trigger for inflammation, for abnormality in the lung tissue. This can also trigger increased asthma attacks because of the inflammatory molecules that are increasing in the lungs. Ultimately, if we can learn to control our breathing, not only are we going to help balance that oxygen and carbon dioxide ratio in our body and also in our lungs, but also we're going to lessen that stress on the body because of that connection to that autonomic nervous system. That's the rest and digest and the sympathetic, that fight or flight. We want to exist more in that parasympathetic. For most of us, generally, asthma patients tend to have a lower than normal HRV, that's heart rate variability, and that's basically a representation of the state of our autonomic nervous system. We want to use those breath control exercises to balance that autonomic nervous system and to improve the oxygen and carbon dioxide ratios. Here's a really great breathing exercise that I find helps to regulate those ratios. We're going to build up our carbon dioxide tolerance by exhaling all the air out. We're going to inhale through the nostrils, and then we're going to exhale until we can no longer exhale, and we're forced to take an inhalation. So let's take an inhale through the nose, and I want you to exhale on a blow, pursed lips, like you're blowing out a candle, but with force. Big inhale. Did you feel that involuntary inhale? that is going to help build up your carbon dioxide tolerance. You're building the CO2 up in the body so you can tolerate it. And that is allowing those chemoreceptors, those receptors that sense the carbon dioxide in the body, to be less irritated, less aggravated, less triggered. And that is one of the things that causes anxiety when those CO2 levels rise in the body. Now, this is also going to help with inflammation in your lungs and in your body. Now, it doesn't work for everyone, but many studies have shown that there are improvements in asthmatic patients. So why not try a non-pharmacological approach where you're also getting many other benefits like respiration strength and core strength? Additionally, many studies have supported the use of intermittent hypoxic training or intermittent hypoxic exposure for an asthmatic patient. Now, this works differently than the breath training, but there are some crossovers. What is intermittent hypoxic training? Intermittent hypoxic training is exposing your body to less than normal levels of oxygen. Normal levels of oxygen is 21% oxygen, and other components in the air are nitrogen and carbon dioxide and some other things. But that main component, that oxygen, is key for us to look at. So usually it's 21%. Generally, we want to lower it to anywhere between 10 and 16% to see a training effect on the body. I use this a lot with my clients for training. Now, for an asthmatic, it has been shown that when exposing oneself to less oxygen, there are certain physiological changes that happen, positive adaptations that happen in the body that can help with asthma symptoms. One of the ways in which intermittent hypoxic training can help an asthmatic patient is by increasing the mitochondria's efficiency at metabolizing oxygen. Asthmatics typically have a less than efficient rate of metabolizing oxygen, so that simply is going to help with the health of the lung tissue and absorbing the oxygen in an efficient way. Also, hypoxic training has been shown to regulate nitric oxide levels in the body. Many asthma patients, there's a typical test that's used to diagnose asthma, which is the amount of nitric oxide that is exhaled. And intermittent hypoxic training has been shown to regulate that nitric oxide in the system. There's another really fascinating mechanism at play here when we're talking about hypoxic training: respiratory plasticity. That is the learning potential of your respiration. This is because of an increased amount of phrenic nerve activity, that's serotonin-dependent phrenic nerve activity. What is a phrenic nerve? Phrenic is actually the biggest, I believe it's the biggest nerve in the body, and it connects to your diaphragm. Now, because of that increased demand of work on the diaphragm, the biggest breathing muscle in the body, it is affecting the activity of the nerve that connects into that diaphragm, and that is helping to increase our learning potential for respiration. Now, why is this powerful for an asthmatic patient? Well, if we are trying to, as teachers, if we're trying to instruct an asthmatic patient to have better breathing by exposing them to slightly lower levels of oxygen, that potentially could enhance their motor learning, their learning of the new respiration patterns. Now, you probably ask, well, how in the world am I going to expose my client, my patient, to a lower than normal level of oxygen if you don't have a hypoxic chamber or you can't climb a mountain to achieve those low levels of oxygen? Well, if you do have those things, wonderful. If you don't, there are certain methods of hypoxic breathing, intermittent hypoxic breathing, that doesn't include any kind of equipment. You simply exhale to the end of your breath like we did in that previous exercise, and then you perform breath holds. Now, you can even wear a pulse oximeter with these exercises. You'll see that your blood oxygen is going down to 80-85% with a 10-second breath hold at the end of your exhalation. So let's practice it together. Ready? Inhale. Exhale to the end of your breath. Blow out through a straw. Keep exhaling, keep exhaling. Exhale for 4 more seconds. 4, 3, 2, and 1. Now hold for 10. 2, 3, 4, 5, 6, 7, 8, 9, and a 10. And then you take a big inhale. Now, you need to perform that cyclically, about 4 sets in a row, and then you want to take a break for 30 to 60 seconds. That is going to lower your blood oxygen, and it's going to have you working your body or even resting hypoxically. Now, you do want to see that area between 80 and 90% to actually achieve those positive benefits. And also, you don't want to go too low. You don't really want to go below 70%, because it's really when we start to get close to 60% blood oxygen, like we see in sleep apnea and that very aggressive hypoxia, that the maladaptation starts. So it's kind of like running uphill on a treadmill, right? There are positive adaptations when you do it short and quick and acute, and there are negative adaptations, maladaptations, when you go too hard, too severe, and for too long. So it's all about titrating and finding your balance. Now, if you go to hypoxics.fitness and join the HYPOXnuts, you can learn a lot about how to safely hypoxically train. A lot of benefits just using your breath, no equipment necessary. Also, hypoxics.studio, if you want to join the classes where you're actually exercising while performing this breathing, which is going to enhance the hypoxic effects and also enhance the carbon dioxide effects, because we are producing carbon dioxide in our body when we move our body. So we get to enhance that carbon dioxide tolerance, and I see 200-300% improvements in the carbon dioxide tolerance tests over time. Thank you so much for watching this video. I do recommend that you train 3 times a week with this intense hypoxic breathing. Make sure to give yourself recovery in between, just like any intense exercise, because you are adding a stressor to see positive adaptation. So you want to make sure that you have enough time in between those sessions to recover. I'm AJ Fisher, creator of the HYPOXiX method, and I will see you at the next video.